Question 1. A 68-year-old male is experiencing sudden onset of slurred speech and right-sided weakness. His blood glucose is 110 milligrams per deciliter. What is the most critical pre-hospital assessment or intervention for this patient? A. Administer oral glucose. B. Perform a Cincinnati Prehospital Stroke Scale. C. Apply oxygen via nasal cannula. D. Obtain a detailed medical history from family. Answer: B. Perform a Cincinnati Prehospital Stroke Scale. This question tests your understanding of initial assessment priorities for suspected stroke patients. The keywords sudden onset, slurred speech, and right-sided weakness strongly suggest a stroke, while the normal blood glucose rules out hypoglycemia as the cause. Performing a Cincinnati Prehospital Stroke Scale, which assesses facial droop, arm drift, and abnormal speech, is the most critical immediate action because it rapidly identifies potential stroke, guiding time-sensitive interventions like notification of a stroke center and rapid transport. For example, quickly identifying positive stroke signs helps activate a stroke team at the hospital, reducing critical door-to-needle time. Remember, early identification and transport to a stroke-capable facility are paramount for improving patient outcomes. Question 2. You are providing ventilations to an apneic adult patient using a bag valve mask, BVM. What is the most appropriate ventilation rate for this patient? A. 8 to 10 breaths per minute. B. 10 to 12 breaths per minute. C. 12 to 16 breaths per minute. D. 20 to 24 breaths per minute. Answer: B. 10 to 12 breaths per minute. This question focuses on the appropriate ventilation rate for an adult in respiratory arrest, a core skill in airway management. The concept being tested is effective bag valve mask ventilation. For an adult with a pulse but who is not breathing, apneic, the current guidelines recommend delivering one breath every 5 to 6 seconds, which translates to 10 to 12 breaths per minute. This rate aims to provide adequate oxygenation and ventilation without causing hyperventilation, which can decrease cardiac output and cerebral perfusion. For instance, giving breaths too fast can lead to air trapping and increased intrathoracic pressure. Always ensure each breath makes the chest rise visibly and is delivered slowly over 1 second. Question 3. A 45-year-old male has fallen approximately 15 feet from a ladder and complains of severe back pain. He has obvious deformity to his left lower leg. After ensuring scene safety, what is your next immediate priority? A. Assess distal pulses in the injured leg. B. Manually stabilize the patient's head and neck. C. Apply a splint to the deformed lower leg. D. Obtain a full set of vital signs. Answer: B. Manually stabilize the patient's head and neck. This question evaluates your understanding of initial priorities in trauma assessment, specifically for falls with potential spinal injury. The keywords fallen approximately 15 feet and severe back pain are crucial clues indicating a significant mechanism of injury and potential spinal trauma. After ensuring scene safety, the immediate priority for any patient with suspected spinal injury is to manually stabilize the head and neck to prevent further neurological damage before any other assessments or interventions. For example, moving the patient without proper stabilization could worsen a spinal cord injury. Remember, manual stabilization of the cervical spine is a foundational step in managing suspected spinal trauma. Question 4. You are treating a 55-year-old male complaining of crushing chest pain described as 8 out of 10. He has a history of angina and takes nitroglycerin. His blood pressure is 98/60 mmHg. Which of the following medications would be contraindicated based on his vital signs? A. Aspirin. B. Oxygen. C. Nitroglycerin. D. Oral glucose. Answer: C. Nitroglycerin? This question assesses your knowledge of medication contraindications, specifically for chest pain management. The critical clue is the patient's blood pressure of 98/60 millimeter of mercury, which indicates hypotension. Nitroglycerin is contraindicated in patients with a systolic blood pressure below 100 millimeters of mercury because it can further lower blood pressure, potentially leading to inadequate perfusion of vital organs and worsening the patient's condition. For instance, administering nitroglycerin to a hypotensive patient could cause them to lose consciousness or go into shock. Always remember to check a patient's blood pressure before administering nitroglycerin. Question 5. Which of the following is the most definitive sign of an upper airway obstruction in an unconscious patient? A. Snoring respirations. B. Stridor. C. Gurgling respirations. D. Absent breath sounds. Answer: D. Absent breath sounds. This question tests your ability to identify the most critical signs of airway obstruction. While snoring, stridor, and gurgling are all signs of airway issues, the keyword most definitive points to the most severe and immediate threat. Absent breath sounds in an unconscious patient indicate a complete or near-complete airway obstruction, meaning no air is moving in or out, which is a true medical emergency. For example, if you hear no sounds and see no chest rise, it suggests a complete blockage. Always prioritize opening an airway when breath sounds are absent. Question 6. What is the primary purpose of applying a tourniquet for hemorrhage control? A. To reduce blood flow to the entire limb. B. To completely stop arterial and venous blood flow to a limb. C. To control venous bleeding from a wound. D. To prevent infection in an open wound. Answer: B. To completely stop arterial and venous blood flow to a limb. This question tests your understanding of the purpose and effectiveness of tourniquets in hemorrhage control. The key concept is that a tourniquet is a life-saving device for severe, life-threatening extremity bleeding that cannot be controlled by direct pressure. Its primary purpose is to completely occlude, stop, all blood flow, both arterial and venous, distal to its application, thus preventing further blood loss from the limb. For instance, if direct pressure fails to stop severe bleeding from a leg wound, a properly applied tourniquet will entirely stop the bleeding by cutting off circulation to the entire lower leg. Remember, a tourniquet is a last resort for uncontrollable limb hemorrhage and should be applied high and tight above the bleeding site. Question 7. You arrive on scene to find an unresponsive 3-year-old child. The child's parents state the child has been ill for 2 days. Upon assessment, you note a respiratory rate of 50 breaths per minute, heart rate of 160 beats per minute, and weak peripheral pulses. The child's skin is mottled. This presentation is most consistent with which pediatric emergency? A. Febrile seizure. B. Bronchiolitis. C. Decompensated shock. D. Croup. Answer: C. Decompensated shock. This question assesses your ability to recognize the signs of decompensated shock in a pediatric patient. The keywords unresponsive, high respiratory rate, high heart rate, weak peripheral pulses, and mottled skin are all classic indicators of inadequate perfusion and the body's compensatory mechanisms failing. Decompensated shock in children presents with signs like altered mental status, absent or weak peripheral pulses, and mottled or pale skin, as their compensatory mechanisms, like tachycardia and tachypnea, begin to fail, leading to declining perfusion. For example, a child with severe dehydration from illness might progress to this state. Recognizing these critical signs early is vital because pediatric patients can rapidly deteriorate from compensated to decompensated shock. Question 8. A 24-year-old male is suspected of having a spinal injury after diving into a shallow pool. He is conscious and breathing adequately. What is the most appropriate method for opening his airway if needed? A. Head tilt, chin lift maneuver. B. Jaw thrust maneuver. C. Oropharyngeal airway, OPA, insertion. D. Nasopharyngeal airway, NPA, insertion. Answer: B. Jaw thrust maneuver. This question focuses on appropriate airway management techniques in the context of suspected spinal injury. The crucial clue is suspected of having a spinal injury. The jaw thrust maneuver is the preferred method for opening the airway in patients with suspected spinal trauma because it minimizes movement of the cervical spine, protecting the patient from potential further injury. For instance, if you used a head tilt, chin lift, you could potentially worsen a spinal cord injury. Always use the jaw thrust maneuver when a spinal injury is a concern. Question 9. What is the primary purpose of early defibrillation in cardiac arrest? A. To restart the heart from asystole. B. To restore normal heart rhythm by stunning the heart. C. To replace effective chest compressions. D. To assess the patient's underlying rhythm. Answer: B. To restore normal heart rhythm by stunning the heart. This question tests your understanding of the rationale behind early defibrillation in cardiac arrest. The primary purpose of defibrillation, especially in ventricular fibrillation or pulseless ventricular tachycardia, is to deliver an electrical shock that stuns the heart, momentarily depolarizing all cardiac cells, which allows the heart's natural pacemaker to potentially resume a normal, organized rhythm. It does not restart a heart that is in asystole, a flatline rhythm, and is not a replacement for chest compressions, which are essential for maintaining blood flow. For example, if a patient is in ventricular fibrillation, delivering a shock can stop the chaotic electrical activity, giving the heart a chance to reset. Remember that early defibrillation significantly increases the chances of survival for patients in shockable rhythms. Question 10. A 72-year-old female complains of sudden onset shortness of breath. She has a history of congestive heart failure, CHF. Upon examination, you note diffuse crackles in her lungs and severe peripheral edema. Her SpO2 is 88% on room air. What initial intervention is most appropriate? A. Administer albuterol via nebulizer. B. Apply oxygen via non-rebreather mask at 15 liters per minute. C. Assist with the patient's prescribed nitroglycerin. D. Place the patient in a supine position. Answer: B. Apply oxygen via non-rebreather mask at 15 liters per minute. This question assesses your immediate management priorities for acute respiratory distress, particularly in a patient with a history of CHF. The key clues are sudden onset shortness of breath, crackles, peripheral edema, and an SpO2 of 88% on room air, all pointing to acute pulmonary edema. The most appropriate initial intervention for a patient with severe hypoxemia, low oxygen levels, is to provide high-flow oxygen, typically via a non-rebreather mask at 15 liters per minute, to improve oxygenation and address the life-threatening hypoxia. For example, increasing the available oxygen will help compensate for the fluid in the lungs, improving the patient's breathing. Always prioritize adequate oxygenation in patients with significant respiratory distress. Question 11. You are preparing to ventilate an adult patient who is apneic with a pulse. Which advanced airway device, if indicated and within your scope, is designed to be inserted blindly and occlude the esophagus, allowing ventilation into the trachea? A. Endotracheal tube. B. Laryngeal mask airway, LMA. C. King airway. D. Nasopharyngeal airway, NPA. Answer: C. King airway. This question tests your knowledge of specific advanced airway devices and their mechanisms of action. The key phrase "inserted blindly and occlude the esophagus" allowing ventilation into the trachea, describes the function of a supraglottic airway device designed for esophageal occlusion. The King Airway is a common example of such a device, featuring cuffs that inflate to seal both the esophagus and the oropharynx, directing airflow into the trachea. For example, the King Airway provides a relatively easy way to establish a definitive airway without direct visualization of the vocal cords. Remember that proper training is required for the insertion of any advanced airway device. Question 12. During the primary assessment of a 30-year-old male involved in a motor vehicle collision, you notice an open, sucking chest wound. What is your immediate priority after assessing the airway? A. Administer high-flow oxygen. B. Apply an occlusive dressing taped on 3 sides. C. Assess for absent breath sounds. D. Transport rapidly to a trauma center. Answer: B. Apply an occlusive dressing taped on 3 sides. This question focuses on the immediate management of a life-threatening chest injury during the primary assessment. The keyword open, sucking chest wound identifies a penetrating chest injury that allows air to enter the pleural space, potentially leading to a tension pneumothorax. The immediate priority after ensuring a patent airway is to seal the open wound with an occlusive dressing, typically taped on 3 sides, a flutter valve, to prevent further air from entering and to allow trapped air to escape during exhalation. For instance, if you don't seal the wound, the patient's lung can collapse further. Remember to address life threats, like a sucking chest wound, as soon as they are identified in the primary assessment. Question 13. A patient is experiencing severe anaphylaxis after being stung by a bee. They are unresponsive, have widespread urticaria, and severe respiratory distress. What is the most critical intervention to perform immediately? A. Administer oral antihistamines. B. Administer epinephrine via intramuscular injection. C. Apply a non-rebreather mask at 15 liters per minute. D. Start an intravenous fluid bolus. Answer: B. Administer epinephrine via intramuscular injection. This question tests your understanding of the immediate treatment for severe anaphylaxis. The keywords severe anaphylaxis, unresponsive, and severe respiratory distress highlight a life-threatening allergic reaction. Epinephrine is the most critical and life-saving intervention for anaphylaxis because it reverses bronchoconstriction, increases blood pressure, and reduces swelling, acting rapidly to counteract the allergic reaction. For example, giving epinephrine quickly can open up the patient's constricted airways and stabilize their blood pressure. Timely administration of epinephrine is paramount for patient survival in severe anaphylaxis. Question 14. What is the best method to assess for adequate perfusion in a 4-year-old child? A. Palpating the radial pulse. B. Assessing capillary refill time. C. Checking blood pressure with a cuff. D. Observing respiratory rate. Answer: B. Assessing capillary refill time. This question assesses your knowledge of appropriate assessment techniques for pediatric patients, specifically for circulation. In young children, capillary refill time is generally considered the most reliable and easiest indicator of peripheral perfusion because their compensatory mechanisms can maintain a blood pressure in the normal range even when they are significantly hypoperfused. While other signs are important, capillary refill, normal is less than 2 seconds, provides a quick snapshot of how well blood is flowing to the tissues. For example, if a child's fingers take more than 2 seconds to pink up after gentle pressure, it suggests poor perfusion. Always remember that capillary refill is a valuable assessment tool in pediatric patients. Question 15. You are transporting a patient who was in a motor vehicle collision. As you reassess them, you note that their tracheal position has shifted to the left, and they have unilaterally diminished breath sounds on the right. This suggests the development of what condition? A. Simple pneumothorax. B. Hemothorax. C. Flail chest. D. Tension pneumothorax. Answer: D. Tension pneumothorax. This question tests your ability to identify the signs of a life-threatening chest injury. The keywords tracheal position has shifted and unilaterally diminished breath sounds are classic, late signs of a tension pneumothorax. A tension pneumothorax occurs when air enters the pleural space but cannot escape, building up pressure that collapses the lung and eventually pushes the mediastinum, including the trachea and heart, to the opposite side, compromising cardiac output. For instance, a collapsed lung can cause severe pressure in the chest, pushing the trachea out of alignment. Recognizing these signs is crucial because a tension pneumothorax requires immediate intervention. Question 16. A 60-year-old male is complaining of severe epigastric pain radiating to his back. He has a history of alcohol abuse. His vital signs are BP 140/90, HR 100, RR 18, SpO 296%. Which of the following conditions is most likely given his presentation and history? A. Myocardial infarction. B. Pancreatitis. C. Gastroesophageal reflux disease, GERD. D. Appendicitis. Answer: B. Pancreatitis. This question assesses your ability to correlate patient presentation and history with common medical conditions. The combination of severe epigastric pain radiating to his back and a history of alcohol abuse are strong indicators of pancreatitis, an inflammation of the pancreas often triggered by alcohol. While myocardial infarction can present with epigastric pain, the radiation to the back and alcohol history point more strongly to pancreatitis. For example, chronic alcohol use is a significant risk factor for pancreatitis, causing severe abdominal pain that often radiates to the back. Always consider underlying patient history when evaluating symptoms. Question 17. What is the appropriate initial action if a conscious adult patient refuses care and transport, even after you have explained the potential risks of refusal? A. Physically restrain the patient for transport. B. Contact medical direction for advice and document thoroughly. C. Inform them you cannot leave until they agree to transport. D. Have them sign a release form and leave immediately. Answer: B. Contact medical direction for advice and document thoroughly. This question tests your understanding of patient refusal of care, a critical legal and ethical concept. When a conscious, competent adult refuses care, your immediate responsibility is to explain the risks of refusal clearly, ensure they understand, and then contact medical direction for guidance. Thorough documentation of the assessment, interventions offered, risks explained, patient's capacity, and medical directions advice is absolutely essential. For instance, you would explain that refusing transport for chest pain could lead to a heart attack at home. Never force care on a competent adult, but also do not simply leave, attempt to persuade, explain risks, and consult medical direction. Question 18. You are assessing a patient in cardiac arrest and are performing CPR. What is the most appropriate depth for chest compressions on an adult? A. At least 1 inch 2.5 centimeters. B. At least 1.5 inches 3.8 centimeters. C. At least 2 inches 5 centimeters. D. At least 2.5 inches 6.4 centimeters. Answer: C. At least 2 inches 5 centimeters. This question evaluates your knowledge of high-quality cardiopulmonary resuscitation, CPR, guidelines. The most appropriate depth for chest compressions on an adult is at least 2 inches 5 centimeters but no more than 2.4 inches 6 centimeters to ensure adequate blood flow to vital organs. Compressing the chest to this depth creates enough pressure to circulate blood, even though the heart is not beating on its own. For example, if you compress less than 2 inches, you won't effectively push blood out of the heart. Always remember to push hard and fast, allowing for full chest recoil, to maximize the effectiveness of CPR. Question 19. A 35-year-old pregnant woman is complaining of severe, tearing abdominal pain and significant vaginal bleeding. She is 36 weeks pregnant. Her vital signs are BP 90/60, HR 120, RR 24. What is the most likely obstetric emergency? A. Ectopic pregnancy. B. Placenta previa. C. Abruptio placentae. D. Preeclampsia. Answer: C. Abruptio placentae. This question assesses your ability to differentiate common obstetric emergencies based on symptoms. The key signs are severe, tearing abdominal pain, significant vaginal bleeding, and the patient's late-term pregnancy, 36 weeks, combined with signs of shock, hypotension, tachycardia. This presentation is classic for abruptio placentae, where the placenta prematurely separates from the uterine wall, causing internal and external bleeding. For instance, unlike placenta previa, where bleeding is usually painless, abruption causes intense pain due to uterine contractions and internal hemorrhage. Always consider abruptio placentae when a late-term pregnant patient presents with painful vaginal bleeding and signs of shock. Question 20. What is the purpose of obtaining a sample history during your patient assessment? A. To gather immediate, life-saving information. B. To determine the patient's baseline vital signs. C. To collect pertinent medical information from the patient. D. To assess the patient's level of consciousness. Answer: C. To collect pertinent medical information from the patient. This question focuses on the purpose of the sample history, a core component of the secondary assessment. The concept tested is systematic information gathering. The sample history, signs/symptoms, allergies, medications, past medical history, last oral intake, events leading to illness/injury, is a mnemonic tool used to systematically gather pertinent medical information from the patient or family after immediate life threats have been addressed. For example, knowing a patient's allergies or current medications can significantly impact your treatment plan. This history provides crucial context for the patient's current condition and helps guide further treatment. Question 21. When assessing a patient with a potential closed head injury, which finding would be the most concerning for increasing intracranial pressure, ICP? A. Dilated and reactive pupils. B. Tachycardia and hypotension. C. Headache and nausea. D. Bradycardia, hypertension, and irregular respirations, Cushing's triad. Answer: D. Bradycardia, hypertension, and irregular respirations, Cushing's triad. This question tests your knowledge of critical signs of increasing intracranial pressure, ICP, in head trauma. The most concerning finding for increasing ICP is the presence of Cushing's triad, bradycardia, slow heart rate, hypertension, high blood pressure, specifically a widening pulse pressure, and irregular respirations. This triad signifies a severe, life-threatening increase in pressure within the skull that is compressing the brainstem. For example, seeing a patient's heart rate slow down and blood pressure rise after a head injury should immediately raise alarms. Recognizing Cushing's triad is a critical warning sign that requires immediate intervention and rapid transport. Question 22. What is the most common cause of cardiac arrest in infants and children? A. Sudden cardiac death. B. Congenital heart defects. C. Respiratory arrest. D. Trauma. Answer: C. Respiratory arrest. This question assesses your understanding of the leading causes of cardiac arrest in the pediatric population. Unlike adults, where primary cardiac events are common, the most common cause of cardiac arrest in infants and children is respiratory arrest, often stemming from conditions like severe asthma, bronchiolitis, or foreign body airway obstruction. If breathing stops or becomes ineffective, the heart eventually stops due to lack of oxygen. For example, a child with severe pneumonia might gradually deteriorate into respiratory arrest, then cardiac arrest. Therefore, addressing respiratory distress and failure early is crucial in pediatric care. Question 23. You are performing a rapid trauma assessment on an unresponsive patient. You note unstable pelvic crepitus. What is the most appropriate immediate intervention? A. Apply a pelvic binder or wrap the pelvis. B. Apply bilateral traction splints to the lower extremities. C. Log roll the patient onto a backboard. D. Assess distal pulses in the lower extremities. Answer: A. Apply a pelvic binder or wrap the pelvis. This question focuses on the immediate management of a specific life-threatening trauma injury. The keyword unstable pelvic crepitus indicates a suspected unstable pelvic fracture, which can lead to significant internal hemorrhage and hypovolemic shock. The most appropriate immediate intervention is to apply a pelvic binder or improvise with a sheet to stabilize the pelvis, which helps to reduce blood loss and prevent further injury. For example, wrapping the pelvis firmly can help compress the fracture sites and reduce internal bleeding. Always prioritize stabilizing unstable pelvic fractures early in trauma management. Question 24. What should be the first action upon arriving at the scene of a motor vehicle collision with multiple injured patients? A. Begin triaging patients. B. Request additional resources. C. Ensure scene safety. D. Perform a rapid patient assessment on the most critical patient. Answer: C. Ensure scene safety. This question tests your understanding of the foundational principle of scene management in emergency medical services. Regardless of the number or severity of patients, the very first action upon arriving at any scene is to ensure scene safety for yourself, your crew, your patients, and bystanders. This involves assessing for hazards like traffic, unstable vehicles, fire, or hazardous materials. For example, you wouldn't approach a car accident if there were live power lines down. Prioritizing scene safety is paramount to prevent further injuries and allow for effective patient care. Question 25. A 78-year-old male is found unresponsive with a blood glucose reading of 40 mg per deciliter. He has a history of type 2 diabetes. What is the most appropriate immediate intervention? A. Administer oral glucose. B. Administer 50% dextrose, D50, intravenously. C. Apply a non-rebreather mask at 15 liters per minute. D. Obtain a detailed medical history. Answer: B. Administer 50% dextrose, D50, intravenously. This question assesses your knowledge of managing a diabetic emergency, specifically severe hypoglycemia. The keywords unresponsive and blood glucose reading of 40 mg per deciliter indicate severe hypoglycemia, low blood sugar, which is a critical, life-threatening condition. For an unresponsive patient with severe hypoglycemia, the most appropriate immediate intervention is to administer 50% dextrose, D50, intravenously, as this rapidly elevates blood glucose levels directly into the bloodstream. Oral glucose is for conscious patients, and oxygen, while helpful, doesn't address the primary problem. For example, if you give D50 to an unresponsive patient, you might see them wake up within minutes. Rapid correction of severe hypoglycemia is essential to prevent brain damage and other complications.